Hello everyone, welcome to the channel Nursevers. I'm Nurse Miss Anthony. In this video, I share how to prepare yourself for a competency-based nursing interview. As we all know, interviews can be a bit daunting, but if you have prepared your answers well in advance, you will be much more confident. So, I'm going to give you some tips and techniques to answer those type of questions. Here we discuss what is competency-based interview. It is a structured interview based on the principle that past behavior is the best indicator of the future performance, which means the interviewer will have a set of questions and criteria in hand, and your answers will be compared against that preset criteria. There, you are expected to answer the questions with examples from your past experiences. Therefore, competency-based interview is also known as structured interview or situational interview or behavioral interview. In behavioral type of questions, more focus is given to the behavior in that given situation. So, what are the competencies expected to ask in a nursing interview? Though the skills and competencies for the nursing is same worldwide, the nursing domains under which these competencies described can be slightly varied in each country. For example, in Ireland, competencies are assessed under 6 major nursing domains. These are professional values and conduct of the nurse, nursing practice and clinical decision making, knowledge and cognitive competencies, communication and interpersonal competencies, management and team competencies, leadership and professional scholarship competencies. Likewise in UK, the same skills and competencies grouped under 4 domains. And the interview questions can be from any of these domains. Usually, 4 or 5 of these competencies will be mentioned in your job specification. So, you have to understand your job specification or the role profile clearly and prepare the situations or scenarios in advance. Here are some examples of situation-based questions that you may be asked. And I have highlighted the areas. Describe a situation. Give an example of a time. Tell me about a time. Give me an example. When you see these type of questions, you are expected to give a short and specific description of a situation. Some people are naturally good at telling stories, but the time is very important. So, preparation is the key. These types of questions best to answer with a key model called STAR model or STAR technique. By this technique or framework, the interviewer gets a full picture of your ability in managing a particular situation. It also helps you to prepare for the interview and to provide an answer covering every area of the question asked. And even if you have not prepared a particular type of question, if you know this model, you can create an answer on the spot without missing the important points. Where S stands for situation, T for task, A for action, and R for result. In STAR approach, as an introduction, provide a brief description of tasks involved in a specific situation. And next, explain what were the steps that you have undertaken to manage the situation or resolve the problem. This will show your knowledge and skill in the area. At the end, the result. What you have achieved or what was the outcome of your action. You can also include what you have learned from this experience. Sometimes, in connection with your answer, the interviewer may ask you what you have learned from the situation or what would you do differently in the future. Here is an example of a competency-based question and answer. Tell me about a time when your communication skills improved a situation. Here the situation is explained as follows. On a night shift, I had to deal with a patient who was delirious and getting aggressive with my colleague. The patient had recently undergone surgery and was connected to multiple tubes and drains. My colleague was desperately trying to explain his condition to him in order to calm him down while he was trying to get out of bed and go home. The scenario explains a post-operative patient with multiple tubes and drains getting delirious and aggressive at night, where the task is managing an aggressive patient who is delirious and prevent any harm to the patient and staff. Also, help him to get a proper sleep. So the actions explained as, I offered help to my colleague, I greeted the patient and asked his permission to help him, which changed his attention to me. As an experienced ICU nurse, I understand losing control over one's own situation makes people more angry and frustrated. So I remained calm and listened him attentively. I agreed to call the doctor as he demanded and offered him a cup of tea while waiting for the doctor. Then I asked about his family, hospital admission, and surgery. While continuing the reorientation attempts, his nonverbal cues revealed that he was in pain. I offered him painkiller and he agreed to take it. With the effective pain management and continued attempts of distraction, he became calm and eventually settled into sleep. In the given example, the steps or actions reveals that there is a good knowledge in managing a patient with acute delirium and also the communication ability of the nurse in that challenging situation. At the same time, this answer demonstrates various nursing competencies that the nurse exhibited. The final step is the result. By helping the patient regain control over his own situation, I was able to settle the patient effectively. Here I learned, as delirium is multifactorial, along with the comprehensive management approach, a continuous assessment is needed to identify the verbal and nonverbal cues in managing acute delirium. The incident was documented to ensure communication. Here in this example, the result reinforces the communication ability of the nurse and the effective outcome achieved with the comprehensive approach in care. Also, the learning that occurred. What makes this a good answer? Or what makes this answer a competency based one? If you look into this answer, along with the knowledge in delirium management, it demonstrates various nursing competencies as well. For example, the effectiveness of communication and interpersonal skills demonstrated by the developed rapport, patient involvement, and the outcome. Willingness of the nurse to help and share the goal shows that she or he is a good team player. The proactiveness of the person reveals the leadership ability. Taking patient consent and greeting exhibits professional ethics and values. Identification of pain from nonverbal cues and its management demonstrates patient assessment skill, critical thinking, and decision making ability of the nurse. Efficiency and effectiveness is demonstrated by being resourceful and by achieving the best outcome. Documentation ensures continuity of communication. As a whole, a quality care was demonstrated by compassion and care, patient-centeredness, and by preventing any harm. This answer demonstrates the nurse is very competent in the area of communication and in many other areas. So, the take-home message is preparation is the key to success. To prepare, read and understand the full job description, identify the competencies that required for the role, prepare 2 or 3 examples for each competencies, use STAR technique to write down your answers, be short and specific, start your preparation early, practice it in front of the mirror or with a family member. So, again, practice, practice, and practice. Most importantly, believe in yourself and ace your interview with confidence. Good luck and thank you for watching the video. Please do comment, and if you like the content, please like, share, and subscribe.